Good day, dental professionals. You're tuned in to the Dental Flow podcast, Dentistry's go-to resource for insights into the business side of dentistry. Host Benjamin Suggs navigates you through the currents of the ever-changing dental waters. This podcast is packed with innovative practice growth strategies, insights, and expert advice tailored to help increase the flow of new, profitable patients into dental practices. Listen as Ben explores the latest trends, shares success stories, and uncovers actionable tips to elevate your dental practice to the next level. Get ready to dive deep into the currents of dental business knowledge and experience the dental flow.
Hello, everybody, and welcome back to the Dental Flow podcast. I am very excited today to have a guest on joining me, and that is Dr. Jeremiah Davis. Dr. Davis is from the Teeth Doctors that practices in Fayetteville, North Carolina. Dr. Davis, thank you so much for joining us.
Hey, Ben, thanks for having us.
Absolutely. I wanted to prepare for our talk here. I was looking at your website. And wow, very interesting guy. I saw that one of the things that popped out right away, as you can see, that you're a U.S. Army veteran, and that's as someone who was not in the military, that's interesting to me because I'd love to know a little bit about how did what you learn and experience in the military, how does that help you manage a dental practice today?
Sure. I think the most important thing about the military, it teaches you selfless service and always giving your best and continuing to serve your greater community. You know, in 2004, I graduating from school, and I always tell people there's no finer institution that you could join that's going to give a young man or young woman right out of the bat leadership opportunities and really a chance to serve and do something well beyond yourself. And the first time I remember feeling that sense of selfless service was in 2001. I went to school early, but around 2001, 9/11 kicked off, of course. And I was walking across the campus. I was a political science major and thinking, great, I was going to go do some other things in my life. And at that moment, when I just remember exactly where I was, right outside of the cafeteria, and I could hear people panicking. And the moment I heard that, you go right to the television screens and you could see those planes crashing into the towers. Right then and there, I knew I was going to do something beyond me at that point. And I originally told my parents that I was going to leave school. I was thinking I was going to go out and just sign up for the military. And a buddy of mine had just walked back and he says, I'm in ROTC. What do you think about joining? And right away, I went right to the ROTC department, told them I was interested in joining. And here I am 4 years later, 2004, walked out and received a commission to go in as a second lieutenant. And I was fortunately enough shipped down to the 82nd Airborne Division at Fort Bragg, North Carolina. And I got to serve there from 2004 until about 2010.
Wow, so Fort Bragg is right there in Fayetteville. Is that correct?
Yeah, Fort Bragg's in Fayetteville. It's a home of the 82nd Airborne Division. And one of the common jokes that people always ask us is, why would you ever want to jump out of a perfectly good airplane?
Wow.
Well, when you're young, it's fun. And when you get older, it changes. But it's just a great time. And I tell you, if I had to do it again, I would certainly do it again. And I've got a big family. And if my kids ever wanted to join, I would feel honored that they would be willing to commit to something much bigger than themselves and to their country.
That's really cool. It's the whole 9/11 thing. I think there's not one person you can talk to who doesn't remember where they were that day. And that's really cool that you took that as an inspiration to join the fight and get involved. And so that's very respectful. Thank you for your service. I'll say that right now.
Sure. Thank you so much for supporting us too. This is every time you think about what's happening today, there's things can be very polarizing, but most importantly, this is our country. And if you don't stand up for your country, it won't be your country very long. So I have a soft spot in my heart for this country and for all it does, and the men and women who support our country and have done so many things to allow all of us to go to the grocery store, live our lives, and do things in a way that we don't have to worry about. In general, we don't have to worry about our peace and security in this country. And that means a lot to me.
Yeah, that's great. Thank you for sharing that with us. So I don't want to embarrass you, but I was looking at your website, and you've got a very, very impressive list of credentials and a lot of continuing education. And I'm going to embarrass you and just list off some of these things, and then I'll ask you a question about it. But Pretty amazing. I don't really think I've seen another dentist with this level of credentials. But so you are a diplomat of the American Board of Oral Implantology. You are a Dawson Academy Scholar. You are a fellow of the American Academy of Implant Dentistry. You are a surgical master of the Interdisciplinary Dental Education Academy. You are a master of the International Congress of Oral Implantologists. And you are a master of the Academy of General Dentistry. I can't even spell most of those things, so I'm impressed that you were able to do all of them at a pretty young age too. So, can you share that with the other dentists who might be listening? Like, talk about your approach to CE and how do you feel like it makes you a better dentist?
Sure. I remember when I graduated from dental school, I looked over and I saw a professor who I really admire. He's still a mentor to this day. And I was telling him, "Oh, I can't wait till we graduate. I think I'm going to be done with all these books." And he just looked at me, just a very solemn look, and he said, "I think it's just starting for you." And right around the same time, I had made a commitment to go to a 1 year AGD program at the Fayetteville VA. And when I got there, my eyes were open very widely to the broad span of dentistry and what were the capabilities. I met several providers who were retired military, and they had been either DENTAC commanders, which means that they have been in charge of the Army's dentists or the dental command, I should say. And I met several specialists. And from there, each week they required us to do a certain volume of advanced procedures. And they not only required us to do them, but they required us to do them with some proficiency. And that really, again, it was just another eye opener of, okay, gosh, dentistry can be so much more than just a filling, more than just a partial denture. And I knew at that moment, okay, I am going to do something more. And when I graduated the Fayetteville VA residency, a provider told us, well, it's great that you guys have done some implants here. I would encourage you to keep going. And I want to say in 2017 or 18, I was introduced to the group who ran the Maxi courses. The Maxi courses are 300 hours of continuing implant education. And I thought, okay, well, I'll listen to my previous mentor. He says, go get some more education. I'll do the 300 hours and I'll be done. And little did I know that it opened Pandora's box for me. And every year from that time on, I picked a continuum somewhere between 180 and 300 hours. And I would do a continuum of advanced surgical, perio, or pros training. And I kept the rotation going. So every year it's either a hard tissue focus, soft tissue focus, or a sedation focus. And when I look back, again, I never had any intentions of kind of collecting these type of recognitions. But over time, it was one of those things where, as you were going along, you were collecting T-shirts while you were doing it, and you didn't realize you were doing it. But it's I look back and I tell everybody too. I think the recognition is one thing; it just tells people the pathways that you've taken, but the information that you've gained, the skill set you've gained, and the camaraderie with your peers, I think, is so important. And this becomes the foundation of how you treat. This becomes a foundation of how you look at cases. And when you get in and you're doing a case, you don't have to be alone in the cases, because as you're going through these courses, you're making connections with people all over the world. And this, again, has been a foundation for growth and development, because you can ask the world experts what they think about certain situations or scenarios, and they can save you the grief or the heartache. And more importantly, they can help you ensure that the patients get the best care possible. So I'm very grateful to the individuals, the experts around the world who've contributed to my learning and knowledge, and I think that is what helped us put patient care at the forefront. At the end of it all, if you were limited, your treatment were limited to things like just fillings or just partials or maybe just extractions, whatever it is that you decided to only focus on. The challenge to that is that sometimes when economies get tough and or when that type of procedure is not coming into your practice, it becomes daunting, because you start to look for, well, how can I get so many more of these, because this is how I fund my life, or this is what I think I need at this moment. But truly, here at the Teeth Doctors, I can say, because our expansiveness of skill sets now, really, it wouldn't matter who walked in the door. We can say we put the patient care at the forefront of every single thing we do, and finances become or the rewards of our treatment become after the treatment is done, we get paid for doing the services that we do. And I like that, as opposed to, if I can do another one of these, I will get this. Actually, as it turns out now, we say, gosh, we hope we can do this as at a very accelerated level. Where what's exciting is not the money at this point. The excitement is actually the level of excellence that you can achieve for you and the patient when you're doing a procedure. And I think this is what continuing education and being around the world's experts have taught me.
That's amazing. And it seems like that, with all the extra continuing education credentials and services that you're bringing in, that you really are offering just an amazing comprehensive list of services in your practice. And I was looking at your website, and I really like your tagline on the homepage and throughout the website, that the tagline is worry free from A to Z. So it really has two different things there. It's the dealing with helping people through anxiety, but you're also kind of have that Amazon model of A to Z, that you've got almost everything they could possibly need under one roof. And that, when I see it all the time, that's really important to patients, because they come, they form a relationship with you, but then if you're say, oh, you have to go here and here and here to do this stuff, it's kind of starting over. So can you talk about that philosophy that you've put into your practice, and what does it ultimately mean to you and your team and the patients at the end of the day?
Sure. I'll start by giving you some anecdotal information. It doesn't mean that it's coming from my practice. For every time we would have to refer a patient somewhere to do something, the patient is anywhere from 25 up to 75% less likely to actually have that treatment done. Now, I'm sure that somewhere in the American Dental Association, there is some information that accounts for this, but this is here anecdotal in my own practice. As the years went on and we started to develop our own programs more, what I started to see was we started to see a higher acceptance in treatment, to the point you're making, as we keep patients internally. And what I've learned from this is that once patients go somewhere and they can get over certain hurdles, and the biggest hurdle is trust, the second biggest hurdle that they have is finances, and the third biggest hurdle is the fear of pain and anxiety. Once they get over those three things, if you ask them to go to a new environment and now have to do that all over again, this is where you have the 25 to 75% less likelihood of them accepting treatment. So the concept of worry free from A to Z came to fruition with looking at these things and saying, how can we service the patients and be able to walk in and take care of them, literally from sealants all the way to sedation, if that's what they needed. So I don't personally with my own hands do them all, but when you come here, having other practitioners who work here, and if the patients were to see me for most of it, they could do it. Or if they want to see a general dentist for other procedures that the general dentist likes to do, or even if we needed to bring someone in, we could do that. But to actually keep the patient in the facility where they learn to build trust, where they learn to overcome the fear and anxiety of dentistry, and also where they actually, somehow looked at us and said, I consider you to be the experts. This is where we've seen a lot of acceptance. And this is where we've seen the patients walk away and say, thank you. Thank you for the fact that we were able to reconstruct them, give them fixed appliances, and put their life back together. And there's another way we can look at this. There's three models in the building system. Okay, if I were to build your house, we could build standard homes. This is a box and a triangle. And this is what national builders do. They go to a city, they will buy 100 or 200 acres, and they'll build 1,000 homes that all look very similar. Then you have semi-custom builders. The semi-custom builders will come in and they say, we have up to 10 designs. You can choose from one of our designs. And then the last option you have is a custom builder. And a custom builder does not care what your land looks like. The custom builder wouldn't care if you knew what type of house you wanted and or if they had to recreate it. They are capable with our own skill sets of saying, if you are willing to do this, we can literally solve your problems. And this is where, again, the teeth doctors comes into play, because I look at us like a custom builder. If you walk in with very little bone, if you walk in with little soft tissue, if you walk in and you say, I can't figure out how to afford it, but I know I really want it. Well, from literally A to Z, we figured out how to control the anxiety. Okay, so I have a full scope sedation, and we're able to do that. IV sedation. Not only do we do IV sedation, but we have full-time registered nurses on board. So they are here assisting throughout the surgery, and they are also here recording and helping out and doing these procedures. So from the anxiety standpoint of view, we've solved that fear. From the finances standpoint of view, we've teamed up with healthcare financing groups. So when you go to a car lot and you look at purchasing a car, no one goes to the car lot and says, "Hey, I'm dragging $25,000 or $35,000 with me in a briefcase, and I've got this guy, and he's got his, he's in security guards with me." This doesn't happen. What happens is they finance, and if we think about bigger dentistry that's more than what I consider single tooth dentistry. This is advanced dentistry where you're working in multiple quadrants. You may be doing multiple implants in combination with crown and bridge, grafting, soft tissue grafting, those type of things. Then this is more advanced dentistry. It requires more planning. And the purchase point is the same type of decision that a person would make if they're buying a Toyota or a Honda. Or how about in this case, this type of dentistry is more like the Mercedes of dentistry because it has an advanced amount of money and an advanced amount of skill set that adds a common to it. So no one would ever go to the Mercedes lot and say, "Well, I'm just going to buy this today and drag it off the lot." You put a lot of time, research into it. And patients who are looking for this type of dentistry do the exact same thing. So one of the things we try to do from that perspective is, again, team up with healthcare financiers and say, "Hey, how do we allow you to help?" We present the information. We present a solution to anxiety, and we also present the solution to advanced comprehensive dentistry and say, how can we put it together? And this is where we create worry-free from A to Z. And the last thing I think you have to do this for both your own skill set and also for the patients. You have to document your cases. And I don't mean just document your treatment note. I mean, you have to photograph your cases. And you have to look back and be critical of what it is you wanted to do, what it is you did, and then how do you go about making sure that if you're the custom builder, you're going to give patients the key to a beautiful house that allows them to live in it and use their teeth for a long, long time to come. And the last facet about being a custom builder, when you're a custom builder, you're on the hook. This means that right, wrong, good or bad, you're going to be capable of coming back and saying, and this is what we'll do now if we need to dig up the pipes, change something, move something. But the patient, because of some of the things I mentioned to you early, they built the trust in you, not built the trust in the fact that if I gave you the money that you would just do the work and be done with it and give me my warranty and this is done. See, if you come back to the teeth doctors, part of the worry free is what happens if you come back after your 5-year warranty and it's 5 years in one day? What if it's 5 years and 6 months? What if it's 6 years? Honestly, we still try to take care of you. And this is where this concept, again, of worry free from A to Z, because, we're here for not just to make the exchange. We're here to be part of your life.
That's really cool. And maybe you could just talk real quickly about, because as someone who's not a dentist, I see the videos of somebody who gets, a full set of dental implants. They go from having, no teeth or teeth they're embarrassed about people seeing to having this beautiful smile. What does that feel like to be in the room when you have a patient where you have changed their life and made their life better and you see just their beaming smile? What does that feel like?
Well, on day one, after the surgery, sometimes a little bit exhausting. But actually, as it turns out, this feels amazing. This is when you think about your life and what you will do with your life as a practitioner. For me, the visions of grandeur are over for me. I'm 5'6" and I'm 140 pounds. I don't think I'm going to make it to the NFL. I I have maybe a baritone voice, but I will never sing on stage in front of a professional, and get paid for this. So what I've resigned myself to is that I will be a dentist and to do something that will still command the respect and give you the rewards of feeling like you've done something to fill your role in life. This is the best you could do.
Yeah,
And
it's
I
life
walk away.
changing.
It is. I walk away every single day, and I see patients who my reward now is them saying thank you. Yes, and I'm not minimizing the financial gains. This is nice, and I think that this is necessary. But I actually look for something bigger, and it's the emotional paycheck. Just yesterday, I had someone who drove from 5 hours for his full arch implant maintenance. Now, I explained to him, I said, "Sir, honestly, I know several dentists in your area. I certainly could connect you. You don't have to drive 5 hours. I think we've seen you for the last several years, and I appreciate you giving us the confidence." He says, "No, something. I just love coming back and seeing you guys, and I'm willing to pay that fee. And, from the bottom of my heart, the only thing I could say was, sir, thank you so much for your vote of confidence. How could you, if you think about a 5-hour distance,
Yeah.
and a man's going to drive from the mountains, it is not just him driving to your dental practice. He has to plan out his entire day to get there. Then he has to drive 5 hours back home. And just to be honest, the implant maintenance may only take an hour and a half. If that doesn't give you a sense of the fact that the person has confidence and trust in you, the reward is simply, this is life changing. And for me, I couldn't ask for a bigger reward at this point. Again, I will. Somebody would listen and say, "Well, this sounds pie in the sky. You got to get paid for this." And of course, this is something that will always happen. We will always get paid for these type of things. But the true reward at the end of the day is knowing that when you were the custom builder, your client came back and your client was satisfied and you were happy and you felt proud of the things that you created. And that becomes the win-win. It wasn't the patient won because the patient got great benefits from you, but you gave away your service, and it wasn't you got a lot of money, but the patient didn't get the service. You both won. And I think when I go to work every single day, I look for opportunities where we can walk away both as a dual win. And I think if you can't do that, that's when you have to say to yourself, okay, maybe this is not a great opportunity. But I've had many examples of this where patients, they come back and they say thank you. But when they say thank you, I also thank them back, because I think that just as much as they got out of it, I, as a practitioner, got something. I became a better practitioner, whether it was a very difficult case or whether the patient, it just required something that was out of my league, but it forced me to learn something more. To me, I'm always appreciative of these opportunities, and so this is again part of how the Worry Free from A to Z came into fold. It was these were life lessons of sitting with patients who were trusting you, but while they were trusting you, you were learning, and they were teaching you how to do this. Do what you do best.
Yeah, it's an incredibly impactful journey to take with someone who starts as a stranger and by the end of it as a friend. That's
For
it's
sure.
very cool. So I also wanted to ask you. I was looking at your website, and I could see on your bio page, you have a very large family. How many kids do you have?
We have 7 kids, my wife and
Wow.
I. And people ask me just in funny things. Every time the patients come, they will ask me things. They will ask me about my religion. They will ask me if it's one wife. They will ask me if we have twins. And just to be clear, so my wife and I have been married 20 years, and we have 7 single kids. She's given birth 7 times, and yes, we have a very large family, according to today's standards, anyways. And so this becomes a part of the teeth doctors as well. This becomes a part of the worry-free model. When I look at my children and I look at my wife and our extended family, I treat patients just like if they were my family. And I do that because I think that's important. The decisions that I make for these patients, I would make the exact same decisions for my own children or my own wife or her family members. And a classic example of this is, I'm a general practitioner, but I sedate almost daily and I take out their molars. But I would also be the one sedating and taking out my own children's third molars as well. And this is how comfortable I feel. And it wouldn't matter if it were impacted or not impacted. It is because I feel like we could do a great job and we could do that job to standard. And this becomes a litmus test for me as well, many times over. If I would not do this for my family, I certainly would not do this for patients. And I think this is so helpful because it helps guide your decision making. Would I do this large graft on an 83-year-old who really is telling me she eats exactly the way she wants? Response: no. If that were my grandma, I wouldn't. But no, if grandma came in and grandma was 83 years old, she was sprightly, in good health, and she were looking to have fixed appliances to improve the remainder of her life. I explained to her what I thought were benefits. I explained to her what I thought were risks, and she accepted. Would I offer this to my grandmother? Sure. But in both scenarios, the driving factor is, does it make sense to do this? And again, the litmus test is, would I do this if this were my family? So I I've gained so much appreciation for having a large family, because that too has been a testament of Will's, and has taught me exactly, how to help manage patient care, and also how to take a break sometimes. Just look at people not for the dentist or the doctor relationship, but just look at them as we're all alike. We're just trying to get through this life. We want to make it home safely. We want to be able to look at people and know, most importantly, the person who's treating for me cares for me. So if we need another 10 minutes on the end of a consultation, 15 minutes, if that's what makes you feel like your questions are answered, if that's what makes you feel like you were informed, great. What's another 15 or 10 minutes? This is what I would do for my family. This is yours. You can have it. And so our large family has been such a blessing and help to me. And many times over now, people come to the dental practice, and sometimes I think they don't come for the dentistry. They just come to see how many more kids we'll have.
Well, I can definitely say that your wife, after 7 kids, is tougher than you and I, for sure. That's amazing.
Yes, I can tell you there's many times I come home and, I live in Fayetteville, but I commute about an hour and 15 minutes each way to work. And after a long day, I want to sometimes come home and complain. And then I look at her, and she's got one in her arm, one wrapped around her leg, and then one is on the floor, like crying. And I sometimes think maybe I should keep walking, but I'm too fearful at that point. I'll get in trouble.
That is amazing. Well, I'm amazed you find time to sleep with the practice, the huge family, all the continuing education. So it's very impressive. And thank you so much for being with us today. Before we sign off, can you just tell people how they can find you if they want to look you up?
Sure. We're the Teeth Doctors in Fayetteville, North Carolina, and our website is www.theteethdoctors.com.
Awesome. Well, thank you so much, Dr. Davis. This has been great. And best of luck to you, and continue doing what you're doing. You're doing an awesome job, man.
Ben, thanks for having us, and we look forward to seeing you soon.
Absolutely. Thank you.
Thank you for joining us for this Dental Flow podcast episode. If you enjoyed today's discussion and wish to stay updated on future episodes, please like, subscribe, and share the podcast with colleagues and friends. For more insights and discussions on dental marketing, we encourage you to continue riding the Dental Flow wave and tune into the next episode. Keep on smiling, learning, and flowing with the Dental Flow podcast.